Thank you, Mr. Chairman. Secretary Price, I have a couple of questions. There's been press reports that the department is working on a rule that would deny birth control for employees. Are you aware of this?
There's a proposed rule that's that's out currently, and on conscientious objection and contraceptive and the contraceptive mandate.
You're proposing that you allow employers to discriminate against women in having birth control be part of an insurance policy provided by employers?
What is currently occurring is solicitation of input, and in that process, I'm not able to make any further comment.
You can't make a comment whether you think that birth control should be part of basic health offered in insurance plans?
I think that for women who desire birth control, that it ought to be available.
Are you promulgating the rule?
I beg your pardon?
You're promulgating the rule?
There is a rule that has been, a proposed rule that has been put forward.
So you think that employers should offer birth control as part of insurance programs and not be able to just say on a conscientious basis they don't believe in providing it?
I believe that women who desire to have access to birth control ought to be able to have access to birth control.
Through their employer?
I believe that women who desire to have access to birth control ought to have access to birth control.
Okay. This is a very big problem. Women cannot be discriminated against by their employer who wants to cherry pick various aspects of women's health. So if this is the intent of this rule, I guarantee you there will be a big fight on this issue. I wanted to ask you about proposed Medicare cuts, because I know the administration had said that they weren't going to cut Medicare, but my understanding is that the budget includes a 2-year extension of mandatory sequestration, which would impose a 2% cut on Medicare providers, such as hospitals and rural hospitals. The extension of the mandatory sequester would be about a $30 billion cut from the Medicare program. So does your budget include that?
I think that what you're referring to is the continuation of current law, and the budget accommodates or reflects current law.
So you're saying that the extension of the mandatory sequester is not a cut to Medicare?
I think that again, it's the same kind of question that Mr. Casey had. It depends what your baseline is. If your baseline is current law, then there are no reductions.
Okay, and so you believe we should be making these reductions to rural health care facilities?
I believe that what we should do is make certain that we have a health care system that is financially viable and feasible and makes it so that the American people have access to the kind of care that they need.
And you think that so you're behind the cut? Okay, I'll just take that as a yes, that you're behind this particular cut. And I would just say that our rural hospitals are struggling to make sure that we are providing good care. There's lots of efficiencies with the delivery system. I had a chance to ask you about this issue of rebalancing on the Medicaid budget, and I don't know if you've had more time to look at that, to rebalance from nursing home care to community-based care. That is something that we wrote into the Affordable Care Act that states are doing, and it's a huge savings to the budget. Is that something that you think the administration can get further behind? Yeah,
as I mentioned to a couple other questions, the dynamism of the health care market is so important to embrace, because we ought to be allowing and accommodating in our system for individuals to receive care where it best suits them and their providers. So you've identified an area where we ought to be able to accommodate that, and the system should allow for it.
Thank you, Mr. Chairman.